So the body is a finely balanced machine. In a perfect condition of the operation of its main parts, everything is covered for. If anything goes wrong in regards to the things that are being moved around the body, there is always enough compensation to make sure that things don't go poorly. But in the case of metabolic acidosis, a major part of our human processor, the kidney, is affected, leading to a disturbance in the combination or the equilibrium of how things are moving. Now, the kidney itself makes sure that acid does not develop or become overpowering for the body. How does it do that? It balances it with the base, making sure that there is no constant process where any one of them is overpowering the other. But in the situation where there's chronic kidney disease, acid begins to pile up in the body. This is what we have to deal with when we talk about metabolic acidosis. The kidney is overpowered and is unable to perform its finely constructed function of making sure that the acid and the base are not overpowering each other. With today's topic, we're going to talk about metabolic acidosis. This is Seco Direct, and I'm your host, Dr. Tiwa. So the classic concept of metabolic acidosis in chronic kidney disease reflects a conventional definition of metabolic acidosis, which is the bicarbonate is typically below 22 millimoles per liter. Now, metabolic acidosis is a common complication of chronic kidney disease, especially as the disease progresses to its advanced stages, typically stage 3 and beyond. As the kidney function goes downwards, the buildup of acids like hydrogen ions and reduction in bicarbonate, the body's main buffer, disrupts this balance. So why does metabolic acidosis occur in chronic kidney disease? Healthy kidneys filter out excess acids from the blood and excrete them through urine. At the same time, they absorb and regenerate bicarbonate to make sure that the blood's pH levels are well finely balanced. However, in chronic kidney disease, the kidney's ability to filter and remove acid is compromised. So once that happens, the kidney loses its function. And the more the kidney loses its function, the less acid they can excrete, leading up to an acid buildup in the blood. This is what we call metabolic acidosis. So this condition can develop gradually as chronic kidney disease progresses, or it can present suddenly in advanced stages of the disease. Studies show that at least 40% of patients living with chronic kidney disease develop metabolic acidosis by the time they reach stage 4 or 5. So what are the symptoms that we need to look out for when we see metabolic acidosis in a patient with chronic kidney disease? The thing is, with patients with metabolic acidosis, the symptoms can be vague or mistaken to other issues related to chronic kidney disease. Some of the common symptoms that we would typically see are fatigue and weakness, because low energy levels can stem from the body's inability to maintain normal cellular environment in an acidic environment, or normal cellular function in an acidic environment. Breathing problems. Your body tries to compensate for that acid buildup by increasing breathing rate to expel more carbon dioxide. So once you see this, that means you are having metabolic acidosis. You could see that a patient starts hyperventilating at this point. We also have confusion or lethargy, as when acid levels increase, it affects the brain function, leading to mental fatigue or confusion. There's also bone and muscle loss. Prolonged metabolic acidosis weakens the bones and muscles because the body breaks them down to neutralize the excess acid. And we also notice loss of appetite or nausea, as acidosis affects your gastrointestinal system. It is important to note that the metabolic acidosis can accelerate the progression of chronic kidney disease itself, as chronic acid buildup leads to inflammation and increased kidney damage, creating a vicious cycle of the kidney is damaged, so the acid builds up. The acid being built up injures the kidney. That is how we get a vicious cycle in this sense. Risk factors are involved that increase the risk of developing metabolic acidosis in chronic kidney disease occurs when the kidney can no longer effectively remove acids from the body. And what risk factors are these? First, a lower glomerular filtration rate. We already spoke about the vicious cycle that occurs with the kidneys not being able to clear acid, and then the acid themselves injuring the kidney. So in this point, there's a higher risk at stage 3 and times 7 higher risk at stage 4 compared to stage 2. That's because the kidney's ability to filter acids has declined significantly as the chronic kidney disease progresses. We would also see reduced ammonium excretion. Reduced ammonium excretion increases the risk 2.5 times higher than the likelihood of acidosis if the excretion falls to 15 micro equilibrium per day. In terms of risk factors, several factors increase the risk of developing metabolic acidosis, especially in people with chronic kidney disease. And this occurs when the kidneys can no longer effectively remove acids from the body. Firstly, lower GFR is a major risk factor with a 2 times increase if you are in stage 3, and if you are in stage 4, 7 times higher the risk of developing metabolic acidosis compared to stage 2. Now, if there's reduced ammonium excretion, that also raises the risk. Moving on, hyperkalemia, that is elevated potassium levels, is also another risk factor, as high potassium impairs the kidney's ability to remove acids, worsening acidosis. Albuminuria, which is when the albumin leaks into the urine, also doubles the risk of acidosis. Lifestyle factors like smoking increase the risk by 43%. Anemia is also a common complication of chronic kidney disease, and it raises the risk of metabolic acidosis by 40% as it worsens the kidney function and further compromises acid removal. Interestingly, higher serum albumin levels also increase the risk by 35% for each 1 gram per dl increase, as it may be a response to worsen kidney function and increase acid retention. The use of diuretics, on the other hand, lowers the risk by 30% because diuretics help eliminate excess fluids and acids from the body, thus providing some sort of protection against acidosis. And lastly, the use of ACE inhibitors or ACE receptor blockers, commonly prescribed for people with chronic kidney disease to manage blood pressure and slow disease progression, paradoxically or ironically as the case may be, increase the risk of acidosis by 24%. These medications may help reduce the kidney's ability to excrete acid, although they remain crucial for long-term kidney protection. Now, what are the consequences of untreated acidosis? First off, bone disease. The acidic environment of the body causes the bone to lose calcium, leading to conditions like osteoporosis. It can also cause muscle wasting because long-term metabolic acidosis leads to the breakdown of muscle tissue, further weakening the body. It can also increase the risk of cardiovascular disease. Studies have shown that metabolic acidosis may also increase the risk of heart disease in chronic kidney patients due to changes in blood pressure and overall metabolic stress on the heart. Now, how do you manage metabolic acidosis in a patient with chronic kidney disease? As I've said earlier, there is a push and pull mechanism that happens with how the kidney is able to excrete acid or increase more base to make sure that the acid-base connection is stable. So, first off, bicarbonate supplementation will help. One of the main issues with metabolic acidosis is the loss of bicarbonate. So, if patients are prescribed with oral bicarbonate tablets, these help to restore the body's buffer system and neutralize excess acid. Secondly, dietary changes. A low-protein, high-vegetable diet can help reduce the body's acid load, especially in patients living with chronic kidney disease. Avoidance of acidic food and beverages. Reduce the intake of high acid foods like processed meat and sodas. This would help the condition. Another factor is making sure that you have regular monitoring of your blood bicarbonate levels. And also, if you're in the advanced stages, dialysis may be necessary to remove any acid buildup. The goal is to prevent acidosis for worsening kidney damage and also to prevent further complications. So to wrap up, metabolic acidosis is a common and serious complication of anyone living with chronic kidney disease, but it can be managed effectively with early detection and right treatment. If you or a loved one is living with chronic kidney disease, make sure to speak to your healthcare provider about the risk of metabolic acidosis and the steps you need to take to prevent or manage it. Thank you for listening to this episode of the Circle Direct podcast. If you found this episode helpful, please subscribe, Leave us a review. Share any questions that you would like for us to go through. And also spread the word about you getting knowledge from this podcast about going to have a proactive lifestyle and also having that information that is key to many diseases in our landscape today. Always remember to take care of yourself and take care of your health. Bye.